Let us discuss about nurses' responsibilities in chemotherapy. During chemotherapy, a nurse must review the prescription of the medication for its name of the anti-neoplastic agent, the dosage of the medicine, route of administration, date and time that each agent has to be administered must be reviewed. Then identify the patient accurately and also identify the medications which has to be administered along with the chemotherapy agents like antiemetics or sedatives. Confirm all the measurements and calculations regarding the chemotherapeutic agent. Double check the ordered doses. Obtain complete blood count within 48 hours of chemotherapy administration and before the chemotherapy begins, especially the WBC and platelet levels. Then know the side effects of the anti-neoplastic agent and the ways to alleviate these effects. Also, the nurse must flush the IV lines and clear the air from tubing with IV fluid to minimize the splashing. When expelling the bubble from a syringe, cover the tip of the needle with a dry sterile gauze. Do not dispose any supplies or unused cytotoxic drugs in patient care area. Use protective precautions like double gloves, waterproof gown and mask if required when handling the body fluids and excreta of the patient who is receiving the cytotoxic drugs. Instruct the patient who is receiving chemotherapy to double flush the commode after each use and to continue for 48 hours after receiving the chemotherapy. Then coming to the safe handling during reconstitution of the drugs. Reconstitution has to be taken place in the designated rooms only. During that time, the nurse must wear appropriate protective equipments before starting the procedure. And also, gloves should be changed every 30 minutes and if it has any visible contamination, it must be removed immediately. Ventilation slots must be left uncovered and the work surfaces must be cleaned with water and afterwards with 70% alcohol. All the waste must be put in the appropriate waste reservoir. After completing the procedure and removing the protective equipment, the staff should thoroughly wash the hands and face. Coming to the patient education, advise the patient to avoid others with infections and instruct them to check the temperature every day. Use prescribed antiemetic. Advise the patient to eat small and frequent diet. Decrease fiber and roughage in case of diarrhea. And increase fluids and take the prescribed medication. And also educate the patient about the hair loss and regrowth of the hair. Thank you for watching.